Are you waking up tired, a little lightheaded, maybe even foggy, even though your doctor says your blood pressure is perfect? I hear this concern from men every single week, usually spoken quietly, almost apologetically, as if it's something you're supposed to ignore. I'm a physician who spent decades caring for men over 50, and I've seen this exact pattern hundreds of times. By the end of this video, you'll understand why chasing the wrong blood pressure number can quietly drain your energy and what actually works. And before we go further, tell me where you're watching from, and if this conversation matters to you, like and subscribe so we can keep talking about your health. But here's what most people don't realize, and I want you to really hear this calmly and clearly. The blood pressure numbers we often call normal were never designed with the aging male body in mind. They were created as population averages, not personal targets, and certainly not with the unique physiology of men over 60 at the center of the conversation. And yet I see men every day being treated as if one number should fit everyone, regardless of age, strength, history, or how they actually feel in their body. As men get older, your arteries naturally change. This isn't a failure, and it isn't a disease, it's biology. Over time, arteries lose some of their elasticity. They become stiffer, less able to cushion each heartbeat the way they did when you were 30 or 40. When your arteries are more rigid, the top number of your blood pressure, the systolic, often creeps up slightly, while the bottom number, the diastolic, may drift lower. That pattern alone already tells us that aging blood pressure behaves differently than younger blood pressure, even before medications enter the picture. The problem starts when we aggressively force an older man's blood pressure into a range that looks good on paper, but doesn't respect how his circulation now works. Blood pressure isn't just a risk factor to suppress. It's the force that delivers oxygen and nutrients to your brain, your kidneys, and yes, your sexual organs. When pressure is driven too low, especially the diastolic number, blood flow can become insufficient where it matters most. I tell my patients this often: your body doesn't care what the chart says if your tissues aren't being fed properly. This is where men start noticing things they don't immediately connect to blood pressure. You might feel unusually tired even after a full night's sleep. You may stand up and feel a brief wave of dizziness or imbalance. Some men describe cold hands and feet that never quite warm up. Others notice mental fog, trouble concentrating, slower recall, a sense that your brain just isn't as sharp. And many men, though they rarely say it out loud at first, experience changes in erectile function that seem to come out of nowhere. These aren't random complaints, they're often signs that circulation has been pushed too far in the name of control. What's important here, and I want to be very clear, is that this is usually a well-intentioned mistake. It's not a failure on your part, and it's not even malicious or careless medicine. Most doctors are following guidelines designed to reduce long-term cardiovascular risk, and that goal is valid. But guidelines are not meant to replace individualized judgment, especially in older men. The human body isn't a spreadsheet, and aging physiology deserves nuance, not rigidity. I can't tell you how many men have sat across from me and said, "I thought this was just getting older," or "I assumed it was all in my head." And I always tell them the same thing: you're not imagining this. Your body is talking to you. Those subtle symptoms are signals, not complaints. They're your circulation asking for balance, not extremes. This is where relief often sets in for men. The moment they realize they're not broken, not weak, not failing, they're simply being treated by numbers instead of by how their body actually functions. Blood pressure management after 60 should be about protection and preservation, not punishment. The goal isn't the lowest possible number. It's the healthiest number for you. One that protects your heart without starving your brain, kidneys, or vitality. And once you understand this, a much bigger question naturally follows. If normal isn't always right and lower isn't always better, how did we get so aggressive with treatment in the first place? And more importantly, What role do medications play in this misunderstanding? And this brings us to the most dangerous misunderstanding I see with blood pressure medications. Now, here's the mistake most seniors make, and I say this gently because it comes from years of being told the same message over and over, that lower blood pressure is always better. On the surface, that sounds logical. High blood pressure is dangerous, so lowering it must be good. But biology isn't that simple, especially as we age. When blood pressure is pushed too low, the very organs we're trying to protect can quietly suffer, and the warning signs are often subtle at first. Let me explain this in plain terms. Your brain depends on steady, consistent blood flow to function properly. This is called cerebral perfusion. It's just a medical way of saying your brain needs enough pressure to push oxygen-rich blood upward against gravity every second of the day. In younger bodies with flexible arteries, that delivery system is forgiving. In older bodies where vessels are stiffer, it becomes far more sensitive to drops in pressure, especially the bottom number, the diastolic pressure. When diastolic pressure falls too low, the heart itself can struggle as well. The coronary arteries that feed the heart muscle receive blood primarily during the relaxation phase between beats, when diastolic pressure matters most. If that pressure is chronically low, the heart is being asked to work harder while receiving less nourishment. Over time, this mismatch can contribute to fatigue, exercise intolerance, and that vague sense of weakness many men can't quite explain. This is where real-world consequences start to show up. I've seen men who were active and steady suddenly become cautious when standing up because they've experienced that brief but frightening lightheaded feeling. Some have fallen, others haven't fallen yet, but they move more slowly, more carefully, because their confidence in their balance has changed. Memory can be affected too, not dramatic loss, but subtle slowing, word-finding issues, or difficulty focusing. These are often blamed on aging, but low blood pressure is frequently part of the picture. Fatigue is one of the most common complaints I hear, not the kind that comes from a hard day's work, but a deep, unrelenting tiredness that doesn't improve with rest. And then there's erectile dysfunction, a topic many men avoid, even in the doctor's office. Erections are fundamentally a blood flow event. When pressure is insufficient, performance suffers. Men are often surprised to learn that the medication meant to protect their heart may be undermining their sexual health. I remember one patient, I'll keep his details anonymous, who came to me in his late 60s. His blood pressure numbers were textbook perfect. His doctor was pleased, but he felt terrible. He was exhausted by midday, mentally foggy, and his sex life had nearly disappeared. He assumed this was just the cost of getting older. When we reviewed his medications and adjusted his targets to better suit his physiology, the change was remarkable. His energy returned, his mind felt clearer, and his confidence came back with it. The numbers changed slightly, but his quality of life changed dramatically. I share that story not to scare you, but to protect you. Overtreatment doesn't announce itself loudly. It whispers. It hides behind good numbers and normal lab results. And unless someone takes the time to connect how you feel with how your blood pressure is being managed, those whispers can go unheard for years. So I want you to understand this clearly and calmly. Low blood pressure can be just as harmful as high blood pressure if it doesn't match your body's needs. The goal is balance, not extremes. And that leads to the most important question of all. If lower isn't always better and higher isn't safe either, then what numbers should you actually aim for? But here's what most people don't realize once they start questioning the numbers. The blood pressure range that truly supports longevity in men over 60 is not rigid, and it's certainly not about chasing perfection. It's about function. It's about how well your body is being perfused, protected and supported so you can live well, not just long. In my practice, the healthiest men are rarely the ones with the most aggressively ideal readings. They're the ones whose numbers work in harmony with how they feel and how they function. As we age, the relationship between the top and bottom numbers becomes especially important. The systolic pressure, the top number, often rises slightly because of arterial stiffness. That doesn't automatically mean danger. The diastolic pressure, the bottom number, becomes more critical because it reflects the resting pressure that feeds the heart and brain between beats. In many older men, problems begin not when systolic pressure is modestly elevated, but when diastolic pressure is driven too low. This is why age-aware targets matter so much. Another piece many men don't hear enough about is variability. Blood pressure is not a static measurement. It changes throughout the day based on activity, hydration, sleep quality, stress, and even posture. A single reading in a quiet exam room doesn't tell the whole story of how your circulation behaves in real life. I often remind patients that your blood pressure during a rushed morning, a poor night's sleep, or emotional stress will look different than when you're calm and well rested. That variability is normal. The danger comes from treating every number as if it were permanent. For men with additional health conditions, this conversation becomes even more nuanced. If you have diabetes, kidney disease, or a history of heart problems, your targets may need to be adjusted thoughtfully, not automatically lowered across the board. These conditions change how blood vessels respond and how organs tolerate pressure changes. Lowering blood pressure too aggressively in these men can sometimes worsen kidney function, increase fatigue, or reduce exercise capacity. This is why cookie-cutter goals often fail the very people they're meant to protect. What I want you to take away from this is empowerment, not confusion. Understanding your blood pressure should not make you anxious. It should give you language you can use to have a better conversation with your doctor. This is not about self-adjusting medications or ignoring medical advice. It's about partnership. The best outcomes happen when a physician listens not just to numbers, but to symptoms, energy levels, mental clarity, balance, and quality of life. I often tell my patients, your blood pressure goal should support your life, not restrict it. If you feel steady, clear-headed, energetic, and strong, that's meaningful data. If you feel dizzy, exhausted, foggy, or disconnected from your body, that matters too, even if your numbers look impressive on a chart. Longevity is not measured solely in years. It's measured in how fully you're able to live those years. When men hear this, there's often a sense of relief and confidence. They realize they're allowed to ask questions, allowed to speak up, allowed to advocate for a plan that respects their age and their experience. That confidence alone can change how they approach their health, shifting from fear-driven compliance to informed participation. But as important as ranges and targets are, they're still only part of the picture, because numbers don't act on their own. Medications, dosages, timing, and combinations play a powerful role in how blood pressure affects your body day to day. And that's why we need to talk about what numbers alone can't explain, especially when medications enter the picture. But here's the part of the conversation that almost never happens, and it's not because anyone is hiding something. It's because modern medicine tends to separate systems that are deeply connected. Blood pressure care is rarely discussed as a whole man issue, even though it affects your energy, your sleep, your hormones, your weight, and your sense of vitality. When we isolate blood pressure to a single number and a single prescription, we miss the larger story your body is trying to tell. Many blood pressure medications, while effective and often necessary, can quietly influence how you feel day to day. Some can blunt energy, others can affect libido or erectile function. Certain classes may contribute to fatigue or reduced exercise tolerance. When this happens, men often assume it's aging again, or they feel ungrateful for questioning a treatment that's supposed to be helping them. I want to say this clearly. Noticing changes in how you feel is not complaining, it's participating in your care. Sleep is another missing piece that deserves far more attention. Poor sleep, and especially untreated sleep apnea, can raise blood pressure, strain the heart, and sabotage energy levels no matter how many medications you take. I've seen men on 3 or 4 blood pressure drugs whose numbers improved dramatically once their sleep apnea was identified and treated. Yet many men go years without being screened, even when they snore, wake up unrefreshed, or feel exhausted during the day. Blood pressure cannot be fully managed without addressing sleep. Hormones, particularly testosterone, also play a role that's often overlooked. Low testosterone can contribute to weight gain, reduced muscle mass, lower energy, and insulin resistance, all of which influence blood pressure. This doesn't mean testosterone therapy is appropriate for every man, but it does mean the conversation matters. Ignoring hormones while chasing blood pressure numbers is like adjusting the thermostat without fixing a broken window. Lifestyle factors deserve a more balanced discussion as well. Strength training is one of the most powerful tools older men have to improve vascular health, insulin sensitivity, and overall resilience. Yet many men are told to take it easy instead of being guided toward safe, effective resistance training. Sodium balance is another area filled with oversimplification. While excessive sodium can be harmful, overly restrictive intake in some older men can worsen dizziness, fatigue, and low blood pressure symptoms. Context matters. So why don't doctors always ask these questions? In most cases, it's not neglect, it's time. Short appointments, long guidelines, and system pressures push conversations toward efficiency instead of depth. But your health deserves depth. You deserve a plan that looks at the whole picture, not just one isolated measurement. The good news is that you are not powerless in this process. Asking better questions, sharing how you actually feel, and understanding how lifestyle and medications interact restores agency. It shifts you from being a passive recipient of care to an active partner. And when that shift happens, outcomes improve, not just on paper, but in real life. And if you're sitting there wondering whether it's too late to fix this, whether the years have already passed you by, I want you to hear this next part carefully. Now, here's what I want you to take in, not just intellectually, but personally. You didn't fail your body. Nothing about what you're experiencing means you did something wrong, waited too long, or missed your chance. Aging is not a moral failure, and it is not a sentence to slow decline. It's a biological phase that requires different strategies, not surrender. I've worked with men in their 60s, 70s, and beyond who believed their best years were behind them simply because they felt tired, unsteady, or disconnected from their bodies. And I've watched that belief change once they understood what was really happening. The body has an extraordinary ability to recalibrate when it's given the right signals. Circulation can improve, energy can return, mental clarity can sharpen, strength can be rebuilt. These changes don't require perfection, they require alignment. One of the most damaging things men carry quietly is confusion, mixed messages, conflicting advice, numbers that look good while you feel anything but. Men deserve clarity, not confusion. You deserve explanations that make sense and a plan that respects both your health and your quality of life. Blood pressure management should not make you feel smaller, weaker, or fearful. It should make you feel supported and protected. Part of that support comes from partnership. A good physician doesn't just tell you what to do. They listen. They adjust. They consider how you sleep, how you move, how you feel when you wake up in the morning. And if something doesn't feel right, it's not disobedience to speak up. It's wisdom. Advocating for yourself is not being difficult. It's being responsible. I want you to understand something else deeply. Confidence and dignity matter. Feeling steady on your feet, clear in your mind, and capable in your body is not a luxury at any age. It's a foundation for living fully. When blood pressure care is done thoughtfully, it supports that foundation instead of undermining it. So if you felt discouraged, unheard, or unsure about your health, let this be a turning point, not driven by fear, but guided by understanding. Because once you see the bigger picture, you're no longer at the mercy of numbers. You're in a position to shape your care, your conversations, and your future. And that's exactly why I want to invite you into the next part of this journey, because you don't have to navigate this alone. If you found this conversation valuable, I want you to know you're not alone, and you don't have to figure this out by yourself. This channel exists to build a community of men who want clarity, confidence, and guidance that actually respects their bodies and their lives. When you subscribe, you're choosing to stay connected to conversations designed specifically for men like you, navigating health with wisdom instead of fear. I believe deeply that men deserve to understand what's happening inside their bodies, not just be handed instructions without explanation. You deserve energy when you wake up, steadiness when you stand, clarity in your thinking, and deep restorative sleep at night. These aren't unrealistic expectations, and they're signs that your health is being supported properly. If this video helped connect some dots for you, share it with another man who might be quietly struggling too. We grow stronger when we learn together and speak openly about things that are too often ignored. And if you've been chasing a blood pressure number that never quite made you feel better, I hope you now understand the truth. The best blood pressure is the one that protects your heart while preserving your quality of life. Take care of your health with patience and confidence. Ask questions, stay curious, and remember, your vitality, your dignity, and your well-being are worth protecting. If this helped you see your health a little more clearly, I want to invite you to join this community by subscribing. This isn't about quick tips or one-off advice. It's about walking this path together. Men over 50 who want to age with strength, clarity, and self-respect. Every conversation here is designed to support you over time, not overwhelm you, and to give you guidance you can actually use in real life. The goal has always been simple: confidence when you move through your day, energy that doesn't disappear by mid-afternoon, mental clarity you can rely on, deep, restorative sleep that allows your body to recover, and a sense of masculine vitality that feels steady and grounded, not forced or fragile. These aren't luxuries, they're signals that your health is being managed in a way that truly serves you. At the beginning of this video, I asked a quiet but important question: why you can feel unwell even when your blood pressure is labeled perfect. Now you know the truth. The best blood pressure isn't a rigid number pulled from a chart. It's personal, it's functional, it's age-aware, and most importantly, it supports how you actually live, think, move, and feel. Remember this above all else. Numbers exist to serve the man, not the other way around. Your body is not a statistic. It's a living system that deserves understanding, balance, and care. Take care of your health because you are worth it.